Okay, my clock reads 6 o'clock on the dot, so I'm going to go ahead and get started. For those of you that are just joining, I'll introduce myself. My name is Caitlin Ensley. I'm the Senior Director of Education and Outreach at the Mental Health Association of East Tennessee. Everyone is joining in listen only mode with their cameras off, with the exception of myself. And I've got your school's counselors on the call as well. So if you have any specific questions for them, you're welcome to ask. Or if there's a question you feel a little bit more comfortable asking, if they weren't on the call, we will have a dedicated Q&A time at the end of today's training. But I can go ahead and get started. As we go through, you can go ahead and put any questions you have in the chat or in the Q&A. As we go through, I'll try to keep an eye on those and see if I can answer them as we come up, or I'll get to them at the end. Knowing myself, I'll probably go a little bit over the hour planned time for the training, but this will be recorded and I'll be sure to share the recording for everyone who registered as well as a copy of the slides. So if you have to, I'm a parent, so I know what it's like if you have to hop away to deal with a fussy toddler or handle bedtime or whatever that's looking like for whatever age kids you have, you can always come back to the information. But we can go ahead and get started. So welcome everyone. Everyone is hopefully here tonight because you're either a parent, you're a caregiver or guardian, or maybe you just care about the well-being of children. Uh, I have worked at the Mental Health Association now for almost 11 years. And I like to say that mental health is a world of gray. It's kind of complicated, and there's not often black and white answers for things. And I could spend a lot of time getting into the nuances. But the goal of today is to talk about the basics. So I'll be covering the most important points. We'll have time at the end for a Q&A, and I will go ahead and share my contact information in the chat. So you can email me with any questions that you have as well. So we can go ahead. Before I get started, we are doing a pre and post test. If you wouldn't mind taking the survey, I'm going to pause here for a second for you to pull it up with your phone. Feel free to skip it. We started doing this as part of a research study with a student from Baylor, and they've completed that study, so no worries about that. So my goal for today is to give the information and tools you need to be able to identify when you have a child that's struggling and then how to help them. Some of the information may be helpful for you as well, but I'll be approaching it primarily from a youth perspective and really more from an adolescent perspective as well. I'll be briefly sharing some background mental health information, statistics, things that can put your child at risk or protect them from mental health struggles, signs and symptoms that could mean your child is struggling, and what you can do about it. Specifically, I'll be sharing about changes that you can make in your home proactively and then resources available in the community. So even then, I'm going to be spending a majority of my time today talking about how to identify poor mental health and what to do when that's happening. It's really important to start the conversation with what mental health is. And mental health is so much more than when someone is just struggling. It's something that every single one of us has. We work on every single day. It's when we've had a stressful day, so we decide to take a bubble bath or go for a walk. I have to be up at the crack of dawn to drive to a conference in Murfreesboro, so I knew I needed to exercise today, so I could be tired to get a full night of sleep. Like all of that is a part of my mental health. If you lose someone close to you and you grieve their loss, that's mental health. Even when everything is going well, that's mental health. People unfortunately don't love talking about mental health because many associate it with just when someone's feeling unwell. But if we start to shift the conversation and talk about it all the time, even when it's great, especially being the example to our kids about having those conversations on mental health, it can break down some of the barriers we're having those conversations. And that's a big part of our role as a parent is to lead by example on how to approach these conversations, no matter where someone is at in their mental health journey. A great definition of mental health, I feel like, comes from the World Health Organization. And they say that someone is mentally healthy when they achieve a state of well being where someone realizes their own abilities, can cope with the normal stresses of life, can work productively, and is able to make contributions to community. I think this is a really ambitious goal and something that honestly we could all be working toward. And I think it's something that I hope for my child. I think at the base level, I hope they can cope with life. I hope they can be productive and happy and make a contribution to their community. And what I love most about this definition is that it doesn't say anywhere that someone who's mentally healthy is free from illness. I think just when like someone has a chronic physical health condition, for example, someone with a thyroid disorder, diabetes, or asthma, those conditions can be managed. And just like those conditions, mental health conditions, people can have them and live well, happy, productive lives, especially if they're taking the steps they need to manage their symptoms. And a number of things can impact our mental health from our genetic code to the environment we're raised in and the current environment, whether that's leaning good or bad. That not only includes the physical structures around us, but the larger environment, physical environment around us, like environmental pollutants, the political environment, the emotional environment. If the people all around us are um, lean negative or are unhappy, then that's going to affect us. And all these factors work together to balance out to give someone their foundation to live a mentally healthy or unhealthy life. Half of people will meet the criteria to have a mental health diagnosis at some point in their life. Some examples of mental illnesses or mental health conditions that you've likely already heard of are depression, anxiety, eating disorders, bipolar disorder, schizophrenia. Um, some of these are extremely common in our young people depression, anxiety, eating disorders. I'll go a little bit more into some of the symptoms that could indicate they are struggling with that. Um, but even though only half of students, or sorry, half of us will get a diagnosis, that doesn't mean only half of us will struggle. We will all have problems in our life that challenge our ability to be happy and confident. And how we address and cope with those problems really shows the strength of our mental health. And like I said, mental health is complex. Most of us have our typical level of mental well being. I like to think that generally I'm somewhere between the shallow and middle end. The shallow end, so we look at mental health like a swimming pool. The shallow end represents when we're mentally well. Maybe we don't have an excessive amount of negative thoughts, emotions, or behaviors, and we have people and things in our life that keep us supported. If we slip down to that sort of middle slope, the middle slope would be when we start feeling a little bit more uneasy, uncomfortable. Someone at this level of mental well being may have a harder time keeping their head above water, and they're more affected by the day-to-day struggles. So if you've noticed, like generally you're having a good day and you encounter like some really bad traffic on the way home, you may notice that you don't really care. You're like, oh, this is just one thing, I'll get through it. But if you're already having a bad day and there's a really bad car accident on your way home and it just gets under your skin, you're frustrated, maybe it makes you anxious, that can be an indicator of kind of where you are in the mental health swimming pool. Is how do those kind of minor annoyances throughout the day affect you? Someone with a mental health condition like anxiety or depression, like I said, they can be anywhere along this spectrum. Just because someone has a mental illness doesn't mean that they're unwell, but sometimes it can make it a little bit harder for them to stay in the shallow end without extra support or effort. And no one is ever just stuck in one part of the pool. We ebb and flow throughout the day. We know ourselves. Hopefully, you know what it takes to get to the shallow end. Um, But especially, let's say we're in the deep end, we can find our way out of the deep end as well, especially with patience, time, a good support network, and for those in that crisis space, some external assistance like therapy or medication. Mental health conditions are very common. Remember, I said one and two, lifetime. One and five will experience one every year. This stat has gone back and forth between one and five and one and four, so it's pretty consistent every time they look at these numbers. And those apply to both adults and youth. Severity varies person by person, but most fall in a mild to moderate severity, with about 5% of the population having what's known as serious mental illness or SMI, or in children, sometimes referred to as SED or serious emotional disturbance. And that's just a way of naming something that falls into a category that results in serious functional impairment that interferes or limits with a major life activity. Most people who will have a mental illness in their lifetime begin to experience symptoms in adolescence or young adulthood. And almost half of people with a mental health condition will have more than one diagnosis in their lifetime. So, again, kind of pointing back to that complexity. And this chart shows you the average age of onset of diagnosis on the right and the percentage of our young people with that condition. So, the most common mental health condition for young people is anxiety. Hopefully, well, I'm sure a majority of people on this call are parents. So, that's probably no surprise. I have an anxiety disorder, so it's something I'm acutely aware of as a parent is trying to I know inevitably I'll pass on some of my fears and worries to my children, but also pass on some of the things that I've hopefully learned on how to manage that. Um, then the second most common are behavior disorders. Those are things like ADHD or oppositional defiant disorder, conduct disorder. The next are disorders like depression and bipolar disorder. And the least common diagnosis is substance use disorder, and the average age of onset is 15. Something I do want to note about substance use disorders is they very often co occur with another mental health condition, which can point to some using substances as a way of coping with their anxiety disorder or their depression or other mental health condition. Um, we do this survey, or this survey is done nationwide every so often, called the Youth Risk Behavior Survey. And the stats from this survey told us that in an average high school classroom, assuming it's around 30 or so students, there are 12 students who could meet the clinical symptoms of depression, six who have contemplated suicide, five who planned a suicide, and two or three who have attempted suicide. So, incredibly common issues in our young people. There are characteristics and life events that can put our children at risk or protect them from mental health conditions. I do want to note that someone can have every single one of these and every risk protector and every protective factor and still not have a mental health condition. So it's definitely not a cause and effect situation. But we know the more of these risk factors our children have, they're more likely to have a mental health condition at some point in their life. And the more protective factors they have, they're less likely to have a mental health condition or the severity will be less. So, most professionals are in agreement that mental illnesses are medical conditions with their root in the brain. They result from an imbalance in neurotransmitters or brain chemicals, but have also been tied to like brain inflammation, or let's say a certain part of our brain is larger than it usually is. And our brain is impacted by our genes, the environment around us, and including everything that we experience. And parenthood, the environment that's created by our parents, is a big part of that. But parents are not just the only part of our child's life. So, anything our child experiences. And we can't do anything about genetics. That just is what it is. Um, But knowing about a genetic risk factor for mental health conditions can help us be more prepared. And much of a child's environment we are in direct control of, especially in those early years. So, creating the optimal environment for their mental health begins with being hypercritical of the type of environment that we are creating for our children and the type of caregiver that we are. And I will certainly be the first to admit, especially in the first year of being a parent, I was an imperfect parent. Um, so there is a long list of potential traumas that someone can experience that increase someone's risk. But one in particular I want to point out are adverse childhood experiences. Adverse childhood experiences, otherwise known as ACEs, can increase your child's risk of struggling with mental health. They include things like abuse, neglect, or other types of household dysfunction. And the more we have, the more likely we are to have just honestly a kind of gamut of struggles, but including mental health issues. Uh, there is a list of 10, and if you have four or more, that's usually when the risk is at its greatest. The greatest opportunity to influence developmental outcomes is in the first 5 years of life. Early experiences, both positive and negative, have a decisive effect on how the brain is wired. And if we understand even the most basic of brain science, we can be better equipped to meet the needs of our young children so they become happy and healthy teenagers and then adults. Everyone has experienced things that makes it harder to navigate through life and make it so much harder to parent. It was definitely a slap in the face to become a parent, and you think you've um, managed all of your things, you think you're set up to be a parent, and then it just comes all washing back again. Um, and some, when they're faced with that, they take the approach of pretending like everything's okay. You don't want your child to think anything is wrong because you want to shield your child in a way from everything that you've experienced. And we don't want them to have to feel like they're parenting us. But kids are perceptive. They can tell when you're not doing well, even if you don't say anything. So how about instead of pretending like everything is fine, we show our kids when there's fire around us, how to use the fire extinguisher, how to stop, drop, and roll to get safely out of the building. It's our responsibility to teach our kids how to face the struggles that they will inevitably face. So when we take a critical look at ourselves, it can feel sometimes a little like an uphill battle of how are we going to overcome all the times when I maybe haven't been the best parent or the things that I've experienced in my past that I know are traumas and things that I'm holding on to. Um, it's not your job to be perfect. Um, the way I approach it is I always just try to be better. So I acknowledge when I a moment where I'm not the best parent I think I can be and promise myself I'm going to really try my best to be better next time. And I think that's what the best parents do is they acknowledge when they're not perfect and try to be better and take actual steps to make those changes as well. So, mental health conditions are very common. Just because your child has a mental illness, you shouldn't take it personally. With proper care and attention, they can be managed. Like I said, I have an anxiety disorder, and I live a happy and fulfilled life. And we can't control every aspect of our child's life. Um, so, simply by being aware, that's a good thing. What we can do is build up protective or resilience factors. And resilience is someone's capability to withstand future stress and catastrophe. So let's look at our child's mental health like a foundation. Genetic predisposition and trauma puts cracks in that foundation. But resilience is like adding extra supports to the foundation. The cracks are still there, but we have those extra supports, so the house isn't going to come crumbling down. Resilience is what helps someone come out of a traumatic situation and not be so traumatized they, are hospitalized or X, Y, and Z. Resilience is that extra layer of protection against all the awful things the world can sometimes throw at us. So, some things that can help build a child's resilience are having close and healthy relationships with family and friends. So, this means working on your relationship with your child to be more open and caring. This also means building a support network for yourself and your family, which is going to be good for everyone's mental health. Having a positive view of self. Make sure your child feels loved, give them compliments to help build their self esteem. They also learn how to talk to themselves from how you talk to yourself. So be kind and forgiving to yourself and let them hear how you're kind and forgiving and caring toward yourself. The ability to manage strong feelings and impulses. This is best learned by being an example on how to manage these things in your own life. If you've heard of co-regulation, this is kind of what I'm talking about. So, like when your child is emotional, you stay calm and consistent and caring. Having good problem solving skills, that's a sign of resiliency. So, it's your job as a parent to teach your child how to take the next step um, when they try something the first time and it doesn't work. Having good communication skills, so talk to your child about what they're doing, why you're doing it. Another sign of resiliency is feeling in control, or if you're able to find positive meaning despite traumatic circumstances. These skills can be innate, but they're also skills we can work on. But I do want to note that these skills are harder to build if we're in an area where there aren't a lot of resources. When someone lives in an environment where there aren't a lot of resources, it's easy to get hopeless and feel helpless. Um, so we want to fix the environment around someone before we can kind of manage the individual. So moving into signs and symptoms of mental health conditions, many, including our children, will struggle with their mental health. A child won't always approach us with our concerns. It's our responsibility as parents to recognize as best as we can with the knowledge that we have if our child is struggling. And a lot of parents will say they know when their child is not doing well, and they may. Um, but also, the teenage years are kind of confusing. Um, so, look out for these symptoms and if you see them almost every day for 2 weeks or more, that's when it's time to intervene. And we'll talk about what intervention looks like. And it's worth noting that just one of these things, if it's one thing and not any other thing, more than likely it's not a cause for concern. If it's still something that your gut tells you you should talk to your kiddo about, then do it. But one thing on its own is usually not something to be concerned about. So, physical warning signs. These are things that you can physically observe and relate to your child's physical health. So, changes in eating habits, eating too much or too little. With eating, also pay attention to an obsession to eat healthy. Just because someone at face value is getting healthy doesn't mean the reasoning behind it is. Also, if they start like hoarding food or you find like wrappers tucked away in their room, that may be a cause for concern. Sleep disturbances. This can include sleeping too much or too little if your kiddo is not able to fall asleep or stay asleep. Um, or let's say they're waking up and they're having nightmares. That's something to be concerned about. Maybe they seem fatigued or tired. They're reporting aches or pains like headaches, migraines, stomach pain, or other physical symptoms without the presence of a physical illness. Also, physical complaints generally related to mental health issues can be more vague. And emotional and behavioral signs to be on the lookout for. If your child becomes more aggressive, stubborn, hostile, or prone to outbursts, you do also want to pay attention to grades. A sudden shift down or up, even, can be indicate a change in someone's mental status. If they lose interest in activities they used to enjoy, let's say they used to be really into baseball and they just aren't into it. Maybe they start missing a whole bunch of practices. that's something that would be a red flag. If your child starts showing difficulty concentrating or focusing, avoiding certain places or people, or just avoidance of people in general, regression to behaviors present at a younger age. For example, if they start wetting the bed again or sucking their thumb. Changes in physical appearance are also something to note, like specifically if your child stops showering, or let's say they start bathing themselves more or grooming themselves more, almost like to an obsessive extent. A change in appearance can also include a change in the type of clothing that they wear. So, specifically, you're going to want to pay attention to if they're always covering certain parts of their body. That can be indicative of self harm. I have a family member with a history of self harm, and clothing choices were very strategic to make sure that shoulders, stomachs, legs were always covered. And even baggy or oversized clothing, especially if that's not what they used to wear, can be a warning sign. When someone loses an excessive amount of weight because of an eating disorder, they may want to hide their bodies. Or even beyond that, it's really more of a sign of body dysmorphia. And so it's just a little bit more complex than someone wanting to cover up their body. Moving beyond that, new or more intense use of a substance to cope. This can include both legal, prescribed, and illegal substances. So, caffeine, nicotine, or let's say your child has been prescribed something by a doctor. That's something to pay attention to if they start taking it more. Other risk taking behaviors, if they start isolating themselves, new or recurrent fears, persistent sadness or frequent crying, self harming behaviors, like I talked about, if they're always covering certain parts of their bodies, you may not always see the physical signs of self harm. Kids are smart. They know it's generally something they're not supposed to be doing. So when you have a kid doing something they know they're not supposed to be doing, they're going to hide it. Um, so if you notice your child is spending more time in their room with the door closed than they used to, let's say you notice that razors have gone missing in your home, that's something to pay attention to. And lastly, I'm not going to dig as much into it as I'd like to, but if your child starts talking about death or dying, making vague or direct suicide threats, saying things like, oh, I wish I wouldn't wake up in the morning. This is a kind of like do not pass go, do not collect $200 situation. Like you need to immediately seek professional mental health care for them. One of the most difficult parts of adolescence is knowing that the time is such a period of rapid change, hormonal, physical, social. So it is completely normal for our children to seem more distant, to seem moodier, and this can make it really challenging because how do you tell if your child is experiencing a mental health issue that is cause for concern, or is it just typical growing pains? So the three factors to help you determine are to look at intensity of the symptoms they're experiencing, the duration, meaning the length, and the domains, meaning where they're experiencing them. So if the symptoms come and go, if they're mild and not disruptive, then generally it's just going to be sort of teen angst. But if the symptoms are more persistent, if they're chronic, are they so disruptive your child doesn't want to get out of bed? Are they so disruptive your child doesn't want to go to school? Are they having any thoughts of self harm or suicidality? This would lean more toward a mental health diagnosis. Again, duration, I said almost every day for 2 weeks or more. For specific diagnoses, you do have to have the experiences, or sorry, the symptoms for a certain number of days, months, years. But 2 weeks is generally kind of a good time frame. And it is worth noting if your child has experienced like a recent loss of a relationship, if someone has died in your family, definitely take that into consideration when you're thinking through these symptoms as well. And domains. So, mental illness is not just something that affects you in one part of your life, it's going to affect you in multiple parts of your life. So, this can be a situation where it's helpful to check in with your child's school. Say, hey, how are they doing in the classroom? And take those things seriously. They aren't always going to be consistent across the domains, but usually there is going to be some effect in every single domain. It just may look different from area to area. If you're noticing any of the signs of a mental health condition, the sooner you can get your child help, the better. Ultimately, you get to make the decisions for their health care. But when it comes to mental health, it's a lot better if they're a willing participant. Treatment for mental health is not one of those things where you can force someone to go and they're going to get better 100% of the time. It works a lot better if someone is going to be engaged in the process and is a willing participant. So, the first thing we can do before we even start thinking about any sort of professional treatment is what we can do as parents right now, even before maybe our child is struggling, to create a good foundation for mental wellness in your home. The best thing you can do for all children, honestly, is to actively work ahead of time to create an environment where conversations about mental health are normalized. First and foremost, you can accomplish this a few different ways. Model sharing about your emotions and challenges positively. Show your child it's okay to talk about feelings. Be open and honest about how you're dealing with your feelings and emotions, and it will make them more likely to open up, even if it's vulnerable, self deprecating, or prideful. If you struggle with your mental health, please don't be afraid to disclose it. If you take medication or see a therapist, if you do yoga or take baths to calm down, talk about it. Again, kids are perceptive. They're going to notice something is happening. And by not talking about it, you don't hide away the topic. You tell them what you're telling them is an indirect message that this is something to be ashamed to talk of. It's not something to talk about. So you're selling a subconscious message that this isn't something we talk about in our home. It is important with both of these two factors that you not stray into the territory where your child feels like they have to take care of you. Because I think we all have stories, maybe from our own lives or people that we know, where our parents maybe weren't doing the best with their mental health. And we had to parent them in some ways because they were having just a really hard time taking care of themselves. It's your responsibility as a parent to manage your symptoms. And I hope that you're able to take some of this information away today for your kids, but also for yourself, because it is no child's responsibility to parent their parent. Some other things we can do: ask open ended questions, ask specific questions. So instead of asking, how was your day? Ask, what was your favorite part of today? Or what was something that was difficult for you today? And keep asking those questions even when you don't get answers. Help your child set healthy boundaries that support and prioritize their mental health. So, teaching them when it's okay to say no. If they want to stay in because they're super stressed out, but their friends are pressuring them to go see a movie or go out to dinner, teach them it's okay to say no. Another boundary you can teach them to respect is their own privacy. Um, I think it's important to give your child time to be alone and in the comfort of their own space. As a parent, I really value those moments when I can be alone and not talk to anyone and just decompress. And if I really value those moments, and I valued them before I was a parent, then your kid needs those moments too. There are also some things you can integrate into your daily family life that are going to set everyone up for success. Don't underestimate the importance of a good night's sleep, having a healthy diet, getting regular exercise. I know I always feel better when I get at least 7 hours of sleep a night. I'm eating well, and I do at least a little bit of exercise. Um, Create a consistent routine whenever possible. Maybe this means right after school, you have like an hour where you go get something to eat, then there's sports practice, then home, dinner, homework, and a little bit of free time. Create the schedule that's going to work best for your family. Everyone likes routine. Create a sense of belonging. Make sure you remind your child that they're important and valued. Give compliments. It doesn't matter how many times you've said it, they will always appreciate it. Plan intentional time together. Spending intentional time together with your child without screens is not only important to create like a bonded family, but also when we're not spending time together, we don't see someone's behavior. So when you're not spending time with your child, you can't tell a medical professional how long they've been experiencing these symptoms because maybe you haven't had the consistency of observation. So that intentional time together is a good way for you to check in and kind of monitor the mental health of your child. Chances are that your child will deal with some kind of mental distress in their life. And our hope is that we have created the type of environment where they feel comfortable talking to us about it. Unfortunately, that may not always happen when our child is struggling. As someone who has personally struggled with mental health, when you are struggling with your mental health, the the kind of logic in your brain can shift a little. So your mind can make you believe things that aren't true. So you may have a great support network, but you think no one will understand. They're just going to leave or they aren't going to get it. And so you don't even think about having that conversation. You're like, I'm going to shut it down or I'll just handle it by myself. Um, or maybe they think they can just push right through it and everything will be okay. This is just a bad day. And before they realize it, the bad day has become 3 months of bad days. Um, these assumptions and fears can make people mask or pretend that they're not dealing with something. And so they can shut themselves off. I mean, we could do a show of hands if we wanted to, but I think everyone on this call has once told someone when asked the question, "Hey, how are you doing today? How was your day?" And we've said fine or good when we really want to say, "My day was awful. It was the worst day ever," or "I'm not doing well," because that's the truth. Um, Even if it's just kind of one bad day. And so we do that for a variety of reasons. So when you're truly struggling with your mental health and maybe have a mental health condition, sometimes it's even harder to start the conversation as the one who's struggling. So sometimes it's your responsibility to start that conversation for your child. Don't necessarily get in your own head about saying all the right things. Don't let your own fears about how awkward the conversation might be keep you from starting it. Kids just need to know they're seen, that you see them. And if your child does come to you and says, "Hey, I'm not doing well. I think I'm depressed, or I think I've got anxiety," it's really important to respect them and take what they're saying seriously. Young people are too often told that they, quote unquote, don't have anything to be stressed about, or their lives aren't that hard. Or we compare it to our own struggles. I don't know about you, but you would have to pay me a lot of money to go back and be a teenager again. Didn't care for it. And when children are made to prove their struggles, it creates one more barrier to them getting the help and the care that they really need. So, I don't want you to stress about using the right words. Really, the important thing is bringing the right intention to the conversation. I am going to share with you some more appropriate or inappropriate words to use because it's not about being perfect. It's about starting from a non-judgmental and caring place. Realize you were your child's age once, but you are not them. You don't have their experiences. You don't have their life. Don't make any assumptions, and always try to stay hopeful. When you're struggling with your mental health, it can seem like there's no end in sight. And so you don't need to tell your kid it's going to get better. What you need to do, what staying hopeful means is that you keep pushing them forward. You keep pushing your family forward into a place that's hopefully healthier. So start the conversations with little things to set it up for success. Make sure you're not preoccupied. Give them your attention. Um, I know as parents, we always have a million things going on. So set your phone aside. Heck, maybe even just turn it off to make sure like they know. Maybe something that you can set up, if this has not happened before, is just having dedicated like phone free time in your home. And that would be a good opportunity to have a conversation like this. Keep eye contact, pay attention to what their eyes are telling you, pay attention to what their body language is. Are they closing off? Are they clenching their fist? Um, those are all good things to pay attention to. A great tip I heard was if you're trying to have a hard conversation, is to incorporate some sort of like physical movement into it. It can help break down some of those anxieties. So maybe go on a walk with your kid and have a conversation then. It can make the conversation feel a little bit more easy flowing. So I recommend just by telling your child what you've noticed. Um, Talk about specifics. So talk to them of, hey, I noticed you've been sleeping a lot, or hey, I've noticed that you you're a B student and now it seems like you're failing your classes. Um, Again, non-judgmental. Um, don't label the process and bring up anxiety, depression, or another mental health condition. Um, People don't like being labeled, and there is a lot of stigma associated with mental health. So people don't like those labels. Remember to ask open ended questions that require more than a yes or no. Understand that the conversation will probably be uncomfortable. It is uncomfortable for a lot of families, for a lot of parents with their children to have those serious conversations. So try not to expect an immediate connection, even if your child has been very open with you. Just be persistent. Don't give up trying to have these conversations, and don't give up paying attention to your child. Ultimately, if they are not willing to talk about it and you're really concerned, like you can make the decision you need to as a parent. Um, but again, it's much better for it to be a back and forth process. And it's okay if your child doesn't want to talk to you, but maybe they are willing to say, "Hey, I'm dealing with an issue." So maybe that's a good opportunity to share with them. Hey, there are mental health professionals you can talk to. If you're not wanting to talk to me right now, would you be willing to talk to someone else? Avoid patronizing or punishing language whenever you can. There are certain words and phrases we want to try to avoid. And the reason we want to try to avoid them is because they may reinforce some of the negative thoughts and thinking that someone struggling with their mental health may already have. Um, so phrases that are punishing or patronizing may include something like, "Oh, you're so smart. How did you let this happen to you?" Or "What did you do to get depressed?" Or even saying like, "Oh, I get it. I've been depressed. I totally understand what you're going through. This moment's not about you, it's about your child." Other things you might not want to say are things like, "Calm down. You're being so dramatic." "Oh, finally, you're up." Instead, maybe say something like, "Hey, it's nice to see you got out of bed early. Let's go get some breakfast. Like, let's have a nice breakfast out together." Being called dramatic or doing it for attention, again, it can reinforce some of those negative thoughts that someone may already have, and they're going to put up even more walls that are going to be barriers to them getting help. It's not fair to punish anyone for suffering. We also don't want to push our own beliefs and assumptions onto the child. Um, so we have to be careful with our own thinking. We don't want to tell them that they shouldn't feel that way, things aren't that bad. And our role is to create a safe and open environment. For a child struggling with their mental health, sometimes all they need is a change in their routine or home life. And that's something that you can do. If that's not enough, then we can add in mental health professionals. So, children with mild symptoms may be able to manage them through healthy coping and self care. Those are things like getting a good night's sleep, we talked about, things like yoga, journaling, meditation, and then self care. When self care doesn't do the trick, that's when we need to seek medical professional help. Self care is any intentional action we take for our physical or mental health. There are long term habits, short term habits. There are things we can do for workplace and our school. I'm always a big fan of doing less. One of the things I like to say is under commit and over deliver. So I'm a big fan of being selective about the things I do so that I make sure I do them well and I'm taking care of myself at the same time. Coping are those extra little things we do during times of distress. So maybe every night you make sure to get a good night of sleep, but you're having a really rough day. So you take a nap that day, or you always take a hot shower, and it gives you just that nice feeling at the end of the day. But you've had a particularly bad day, so you take a bubble bath. They should be a little bit different, a little bit like the cherry on top of things that make us feel good and warm. The most common type of coping strategies we used are emotion focused coping, which is when we realize we can't do anything about the situation we experienced. So we are going to make sure we feel better. This is a slide taken directly out of our in-school mental health educational program. It looks a little different. I'm not going to go through it, but I will provide a copy of the slides afterwards. And I'm going to click through a few other things like guided meditations. I'm a big fan of guided meditations. And these are some apps that are available for iPhone and Android that you can download or your kiddo can download. I always recommend giving apps a test before you recommend them to your child. Finch is really popular. It is also worth noting, I didn't put on the slide, but AI is a really common tool that our young people are using. It's not uncommon for folks to use tools like ChatGPT as pseudo therapists or to ask questions about mental health. And those tools aren't always giving out the most accurate information. So that's something to be aware of. Depending on the severity of a child's need, you can either start with a change to coping skills, um, but if they don't alone address the severity of the concerns, I always recommend taking step with a professional, and you can do both of them at the same time. And if you ultimately go the therapy and or medication route, more than likely there will be skills and life changes that need to be made as a part of that. So we try to start, and we should start with our child's doctor because they can rule out physical health conditions like anemia, Lyme disease, or thyroid disorders. But once they have cleared your child physically, then the next step is mental health treatment. And there are a few different types of professional mental health treatment. The most common type, and it doesn't really come out here, but it's bolded, is the outpatient treatment. This is your standard therapy session. Sessions last about 45 minutes to an hour generally, and they will differ based on the therapist and the type of therapy that's being done. I personally, when it's a child involved, I think family therapy is the best approach. So there's space for you in the process as well as the parent. But sometimes the kid just wants it to be all their own. And you get to decide with your child what's the best type. And I'll point out a couple of other types of treatments. Medication, that's a big one. I typically don't recommend medication unless it's done at the same time as another form of treatment. Medication can absolutely be life changing, but Results can be temporary or potentially have side effects that present new challenges. So, if someone is doing things like therapy at the same time, they'll be able to build those skills and retrain their brain so that if medication doesn't work for them or it stops working, like they have those skills their entire life. But I have a thyroid disorder, my dose is going to change throughout my life. And the same thing can apply to someone's antidepressant or anti-anxiety med. And the last treatment is I'm going to specifically pinpoint is residential or inpatient treatment. This can vary from a short hospitalization if a child is experiencing an acute crisis, meaning like if your child is actively suicidal, if they're self-harming, or even homicidal. Stays can be longer than a few days if the needs call for it. Generally, like an acute stay is going to be like 36, 72 hours. But there are other hospitals that offer longer stays, and longer is generally going to be around 30 days max. There are facilities that offer longer stays, but beds in those facilities are a little bit harder to come by. There are a few different types of initials you'll see when doing research on what type of mental health professional to get your child in to see. Honestly, no one type is better or worse. They're just trained differently and approach things in different ways. I'm a social worker. I'm an MSSW. I am not licensed to provide therapy. So I'm most confident in describing the approach as social workers. But again, everyone is just kind of trained a different way. There are a couple I want to, well, a few things I want to point out. Most of the initials you'll see have L in front of them. That means licensed. Um, Peer specialists are not licensed. They can also be a licensed mental health professional and a peer specialist. A peer specialist is someone who has a mental health condition or substance use disorder, and they're trained on how to use their experience to help others. And pastoral counselors may or may not be licensed. I personally recommend if faith is a really important part of you, your family, your child, especially when it comes to any form of mental health treatment. There are a lot of faith based licensed professionals. And generally, I only recommend, well, I primarily recommend licensed professionals because therapists aren't perfect and there are going to be people that mess up and maybe do things they're not supposed to do. If someone's licensed, that means they have a body over them that you can report if someone is doing something they're not supposed to do. And that report pathway can sometimes not be as clear in someone who's not licensed. When you've made the decision that your child needs professional mental health care, I recommend involving them in the process. Don't force it against their wishes. At the end of the day, you do have to make the decisions that's best for them. But again, therapy is not one of those things where you can just push someone in the door and expect change to happen. Um, I have willingly stepped into a therapy room and not been a willing participant. And it took me a long time to become a willing participant. Well, once I did, that's when the change started happening. So, to help your child feel like they're a willing participant, it can be helpful to have them do research on the different options for therapy they have. So, there are different types of therapy, um, like DBT, CBT. Um, for trauma, there's even things like EMDR or exposure therapy. So it can be helpful to do your research. Unfortunately, if you're going to what's known as like a community mental health center, like Cherokee, McNabb, or Omni, you won't have much information going in about the values and who your therapist is. But if you are like on a workplace insurance or have private insurance or have like a marketplace plan, generally, you're going to be able to find a private practice group that has therapists. And generally, those private practice groups will have bios about their therapists. And so that is a good way to see, is this person going to be a good fit for me? So people, they're just like us. They will share as much or as little as they're comfortable with about themselves. So if they're most comfortable working with children, with people experiencing trauma, they will share about that in their bios. And so that can be a way for you to feel like you are connected with them. With that being said, sometimes the best person for you is not someone you feel like most comfortable going into that process seeing. For example, I first started going to therapy of my own choice when I was in college. I was at UT, and they made me an appointment with Dr. Ashley at UT Counseling Center. Well, I thought, oh, that's a woman. That makes me feel good. I'm going to feel comfortable. And I walk in, and Ashley was a man. And it just threw me for a loop. But he was exactly who I needed to be seeing. And so you can do your research, and sometimes it's just there's good fits and not good fits. So it's also about who is going to push your child, who might push you, and who's going to get you to where you want to be. When it comes to therapy, especially for your child, um, it is important to remember that there is a certain level of confidentiality. And I personally, I wouldn't want to take my children to see a therapist who's, especially as a teenager, who told me every single thing my child was talking about. I would want to take my child to a therapist who told me about the changes I could make in my home for things to be better, but I wouldn't expect them to tell me every single thing that my child is telling them. A few other things important to know about therapy. If you're nervous or uncomfortable with the idea of leaving your child alone with a therapist, absolutely take the time to get to know your child's therapist before they engage in treatment with them, which is another reason why I kind of recommend taking it from a family approach because that's built into the process. Um, and you should also be able to sit outside the room or in the waiting area when your child is talking to the professional. It would be a big red flag for me if a therapist told me to just like leave the space. And in the state of Tennessee, when it comes to behavioral health care, it is important to know that age of 16, young people can consent to their own medical care. This is called the mature minor exception. And so that means your child doesn't need your approval to seek care, and you can't force them to receive treatment against their wishes. So that is important to know. Medication is also something that's often brought up as a part of this process. It's best practice for someone to receive therapy, to also take some sort of medication. Generally, for young people, what's recommended is medication and therapy at the same time. Um, but you ultimately get to make that decision based on what you feel comfortable with, what your child feels comfortable with. However, at every stage of the process, from the counselor you go to, whether medication is a part of the picture, I would encourage you to do research on what is the best option for you, what is the best option for your family, and advocate for yourself and your child. If you see something happening that you don't like, say something about it. Real quickly, I'm going to go over some crisis resources. A mental health crisis, as a reminder, is when someone is suicidal, homicidal. It can be someone is actively self-harming. The first number I recommend calling is Knox County Mobile Crisis. They will have a trained clinician do an assessment, and they will tell you the least restrictive course of action. So that may be going to like a walk-in center, or they may say, okay, you're good to make an appointment with someone. Call 911 if your child needs immediate medical attention. This is generally going to be if there is any sort of substance involved, if um, or if you're in, or if there's any fear involved on your end, like if you're afraid of your child. And then a non-emergency number is great for what are called safety checks. So this would be less so like for your own child, unless, like, say, for example, you were traveling out of state and wanted someone to check in with your kid because they weren't answering your calls. But if your kid comes to you and says they're worried about a friend, this might be a more appropriate option so they can have someone go over and make sure their friend is doing well. Whenever possible, when communicating with law enforcement, ask if they can provide a CIT officer, a crisis intervention team trained officers. These are officers who have received mental health training to be able to better intervene during times of crisis. And always be explicit about the fact that is a mental health component to your call. There are too many stories about those situations going wrong. So do everything you need to do and put all the information out there so they have all the information to work with. Mental health recovery is not one and done. It's an ongoing process. Don't pressure your child to be normal. Rather, learn to accept and appreciate their new normal. Even though having a mental health condition can be debilitating, it doesn't have to be. And how you react to and support your child can make a big difference. Mental health recovery, it's not simple, it's straightforward. Don't give up if there aren't any changes, and treatment is an individual process. The typical approach to treatment works for a lot of people, but it also doesn't work for a lot of people. So that's why there are alternative treatment methods now developed to help those sort of treatment resistant cases that don't respond to therapy or medication. If you are joining today and your child already has a diagnosis and you're wondering how you can support them, first and foremost, accept that no one is perfect. For certain mental health conditions, you will have to be more patient and flexible, but with time and consistent effort, things will get better. It's part your responsibility to create the space for them to thrive, but it's also their responsibility to work on their own recovery. Make sure your expectations are clear and concise. Don't get upset if they're not consistently met. Honestly, that's not even a mental health condition. That's just a kid thing. Kids' brains aren't fully developed. And so that's important to know. Be sure to praise your child and recognize that they have strengths even when they're struggling, and use positive reinforcement. Um, so when your child misbehaves, explain what they did wrong, redirect. When you see them making positive choices, reward those. If they're making a poor choice, step in with a consequence. Do something positive, step in with a positive consequence. You also want to model good behavior. You don't want your home to be do as I say, not as I do. So if you want your child to practice self-care, get a full night of sleep, then you also need to show that you're going to get a full night of sleep. Share your emotions in a healthy way, how you address them. And also, it's not my final note on this, it's not easy being a caretaker of someone struggling with their mental health. Make sure you are getting the time and support that you need. And in fact, NAMI is another mental health organization, and they have a lot of parent support groups that can be great to check in if you need that extra support. This is my contact information. Your school's counseling team is on the call. You're more than welcome to ask them some questions. Here are some great websites. My personal favorite I like to call out is the Child Mind Institute. They have some great, very specific articles on certain mental health issues. You can scan this QR code to evaluate today's training. I'll leave it up for a second more. And then we can go into the Q&A. I know I've got one question or a couple questions already in the chat, but if you have any other questions, you can go ahead and ask them in the Q&A or in the chat. And otherwise, the call will just conclude when everyone has left the training space. So I'll go ahead and stop sharing my screen. And I can get into the Q&A. So, how do you find a professional in the area that matches your values, faith-based? Can you provide a website? I've seen a bio that said she was faith-based, but then worked to a work site and it was different. How do I trust the process? So I can share some websites. If you feel comfortable emailing me, I can share you some specifics. If you're willing to travel, I know of one office in Blount County that is faith-based, and I think there's a couple in Knoxville that are faith-based as well. And if you're not certain, you can always call. And when you have that first appointment, it is I kind of view it as like dating. Like you're dating your therapist. Like you're figuring out if you're going to be a good fit. I recommend everyone give their therapist at least 2 to 3 visits to tell if it's going to be a good fit. Because I think it is important to find someone that challenges you. But I think there are also some people that are just oil and water. Like you're going to walk in and you just know, like, this isn't going to work. But something also important to note is, at least in social workers, and I'm sure in a lot of other professional backgrounds, we have a code of ethics. And part of that code of ethics is to not bring our personal beliefs into the room. It's really about leading the client, leading the patient to what is healthy for them. So there are plenty of therapists that completely disagree with their clients' opinions, and they disregard those personal feelings because they know this is my client, and let's help them find health for them.